My name is Ethan Parke, and despite my age, I have a daughter who is in her second year of pre-kindergarten, and I want to thank you, Vermont legislature, for recognizing early childhood education as a public good and funding it with taxes. It is one of the best things you've done in recent years, universal, publicly funded pre-K. In my opinion, your record is not so good on health care. I'm 67 years old. I've worked all my adult life. I'd like to scale back and do all the things they say you should do to stay healthy: exercise, sleep, work in the garden, read books, volunteer in the community, eliminate stress. But I cannot retire because although I would go on Medicare, my wife and daughter would not be so lucky. I must keep my job in order to have health insurance that covers them. I have been in favor of universal publicly funded health care for as long as I can remember. I have attended countless public hearings just like this one here in this building. I think the first one I attended was in 1987, and it was around a bill introduced by Representative Paul Poirier and Senator Peter Welch to fund health care for the uninsured using a combination of payroll and income taxes. I hate to say this, but nothing ever changes. We are offered false hope, including now the well-intentioned ACO and all-payer schemes. These ideas are supposed to control costs and maintain quality. We don't yet know if they will do that. We do know that payment reform by itself will do very little, if anything, to increase access. Polls show a majority of Americans favor single-payer Medicare for all. 85% of people identifying as Democrats favor it. I think the same could be said for universal primary care. Yet many Democratic office holders tell us that now is not the time. It can't be done. It's too much of a change. It's too complicated. More studies are needed. The governor will veto it. Federal law is in the way, and so forth. I've heard it all. Many of you are philosophically on board, and I thank you. But shallow understanding from people of goodwill is more frustrating than absolute misunderstanding from people of ill will. You know who said that? It was Martin Luther King Jr. Now we are faced with devastating cutbacks from the federal government, cutbacks in Medicare and Medicaid and ACA subsidies and CHIP and funding for FQHCs. What better time than now for the Vermont legislature to devise a system to provide health care for all people despite the cruelty coming out of Washington? Please do not let this session go by without taking a meaningful step forward on access to health care. You have the universal primary care bills before you. Please work on them to strengthen them and to add the nuts and bolts that will get us to our goals. One idea would be to expand FQHCs to every corner of the state and to provide them with funding to make primary care universal and free at the point of service. Where there is a will, there must be a way. Thank you.